Hi, this is Kenny from Aiskyra. Today's short video is about the types of queries that you can ask our AI medication expert to get the most out of our platform. Now, when I'm referring to query, I'm referring specifically to the message or the question that you type on our AI medication expert in the chat bar at the very bottom of the screen. Of note is that you can also, besides typing in your message, you can use the voice dictation tool that's right next to the send button, and you can dictate your query to the AI as well. Now, in terms of the types of questions you might want to ask our AI, I've kind of separated them into two different categories. And one of them is simple queries, and the second one is complex queries. So by simple queries, I'm referring to simple knowledge retrieval. So these are the types of queries that before AI existed, before the world of ChatGPT and conversational chatbots, you probably would have typed this type of question or query into like a Google search, maybe a Google Scholar search, maybe into PubMed, just to see what kind of articles or websites could be retrieved. And then you would click into each individual article and you would try to retrieve that tidbit of information from there. Complex queries, on the other hand, are obviously more complex. So one version of that would be synthesizing and combining information from multiple different sources. So maybe a PubMed article here, a product monograph here, a practice-related guideline here, and combining that all to form your answer. And this is made capable much easier through our AI medication expert. The other type of complex query will actually include patient cases, right? So with many, many different parameters and factors to consider to generate the right and most relevant answer. And I'm going to show you how our AI medication expert handles all these types of questions with examples. So let's start with simple types of queries. So knowledge retrieval, as I mentioned before. So common questions that you might want to ask our AI would be, let's say, starting dose of metformin, or the amoxicillin dose for acute otitis media for children. Or you might even ask, patient has reported a side effect. Is it potentially caused by any of these medications? So let me show you how the AI answers the question. So for example, what is the max dose metformin? Simple knowledge retrieval type question. So you can see that it separates the metformin into different types: immediate release, extended release, as well as renal considerations. Now let's look at amoxicillin acute otitis media dosing child. Okay, so you can see here, child over 2 years of age, the suggested dose is between 75 to 90 milligrams per kilogram per day, divided twice a day. Now, if you want to take a look at any of the references, you could click this, and it'll actually pull you to the reference. So you can see that if you go to first line treatment, so this is from the Canadian Pediatric Society in terms of AOM for children. If you scroll down to the table where it says antimicrobial agents, first line therapy, you can see it right here. And it's basically the AI is retrieving a specific answer based off of your context, and it tries to find the right reference or practice guideline to answer that question. Okay, so now here's where the AI capabilities of our AI medication expert really come into bringing more and more value to you as the user. The first one is the synthesis or combination of information from multiple different sources. So I have a question here. For example, a 55-year-old patient with chronic kidney disease and hypertension, no other medical conditions. What is their target systolic blood pressure? So you can see there's a few different things going on here. It's the age of the patient, plus their other comorbidities such as chronic kidney disease and hypertension, and then it's asking a target blood pressure. You may need to actually consult a few different sources, maybe one for hypertension, the drugs for hypertension, and one for hypertension and chronic kidney disease, and then have to find where among that is the target systolic blood pressure. So here's the example. Okay, so you can see that the target systolic blood pressure is less than 120, which is correct according to if you're following Canadian guidelines. Then also you can see in the references, you can click into each reference. So this is from hypertension, and this one is from KDIGO, if you want to do further reading on the source material. Next question is when to consider amoxiclav versus high-dose amoxicillin for treating community-acquired pneumonia. So obviously this may not be an answer that you can just find off of in a single article. You might have to look into a variety of different articles or guidelines to get their answer. And so here's the question. And so now it goes into what is the indication for high-dose amoxicillin, what's the indication for amoxiclav, and what is the rationale for using one over the other, and including a summary with a link to the reference if you want to read more. The last example I have, do I need to dose adjust for these drugs due to smoking? So something like this, if you're lucky, there would be maybe a chart that conveniently answers this question. However, you might need to actually read multiple different references, maybe some from PubMed, maybe some from a product monograph, maybe some from a third-party source. So let's try it out. So here's the question. Okay, so what the AI has done here is it takes every single drug and compared it with smoking and how smoking affects each of those individually. So here we have caffeine and smoking, duloxetine and smoking, clopidogrel and smoking, etc. And explains the effect of the smoking, the change if you quit smoking, as well as potential action that might be required. And then here is where it pulls the information. Once again, the reference. In this situation, there was a convenient chart for it to pull the information from, but that's not always going to be the case. It might need to pull information from various different sources and combine it all and synthesize it all into one answer. Okay, so the second type of complex question is actually patient cases, right? With many different parameters and factors. And I'll show you an example here. So here, without reading the whole thing, what I'm going to say is that these types of patient cases typically have factors such as the age, past medical history, current or past medications, current metrics or measurables such as blood pressure or heart rate. It might also include signs and symptoms or chief complaint that the patient is going through, followed by the question is how do you manage this condition? Okay, so here's the question. So even though I haven't mentioned something called a care plan, we have actually instructed the AI to understand that when complex questions are asked, the person asking it is probably likely asking for a care plan, which would typically include things like goals of therapy, therapeutic alternatives, the actual summary of the drug therapy plan, as well as the follow-up plan that includes safety and efficacy endpoints. So let's take a look in this situation. So this was a person, we have an age consideration, we have a past medical history consideration, medication history, parameters for blood pressure and heart rate, current medication, and a chief complaint. And so here the answer is basically, one of the preferred answers would be starting with IV furosemide. And so here we have main drug therapy problem, goals of therapy, parameter, degree of change, and the time frame, the summary of the therapeutic alternatives to consider, the actual recommended therapeutic alternative. We've also instructed the AI to consider deprescribing, which is very important as part of pharmacotherapy management as well. Safety and efficacy endpoints, a follow-up plan, any specific knowledge from Canadian guidelines, and then obviously the references to read more about that. So in our second and final patient example, we have a 67-year-old female with worsening shortness of breath, no fever or cough, just finished some course of antibiotics for pneumonia, currently using medications, and this is an asthma exacerbation. What can we do about their inhaler therapy? So here's the answer. So here you can see that some of the therapeutic alternatives include increasing the corticosteroid dose, adding a medication, a LAMA, which in this situation they've recommended tiotropium or Spiriva. And they've also included other monitoring parameters as well. Yeah, so I hope this short video was useful to you so that you have a better understanding of the types of queries you might consider asking our AI medication expert. If you have any questions, feel free to reach out to us at aiskyra.health@gmail.com. Thank you.